everyone, my name is James Ng. Welcome to Next Gen Link. So today we are very honored that we have invited Miss Nurizzaty to come to our show to talk about an issue about mental health. So Miss Nurizzaty, would you like to introduce yourself?
Yes, okay. My name is Nurizzaty binti Abdul Qais. You guys can call me Izzati. I'm a final year student in Bachelor of Counselling in Industri Malaya. And I think that's all. And now I'm doing my internship at Seremban.
Okay.
Okay.
So basically what we are going to talk about is regarding a mental health issue, which we have seen a lot in the newspaper recently. We have saw that I think that recent 1 week I saw 2 or 3 news regarding suicide.
Yeah, true.
I think this is highly connected with a mental health issue.
Yes.
So in order to create an awareness to the public, that's why we are going to do this video now. And the first thing first, let's start with a really simple thing. So Miss Nurizzaty, can you tell us what is the definition of mental health?
Okay, so what is mental health? Okay, first, we have to know the definition. Okay, they defined by the WHO, which is the World Health Organization, saying that it is a state of well-being in which the individual realizes that his or her own abilities that can cope with the normal stresses in life, they can work productively, and they can able to make a contribution to the community. So what is the include in the mental health? We have to know these 3 components. They're very important because if one component affected, the 2 others will be affected as well. All right. So the component is the first is our emotional, our psychological, and our social well-being. So it affects how we think, how we feel, and how we act. Okay. All right. Okay. So it also helps us to mean how we handle the stress, because nowadays pandemic, the stress is, we can't deny the stress. Okay. So as well as we have this mental health, it helps us to make the decision day by day and make the choices. All right. So mental health, it is very important. I repeat, it is very important at every stage of life, from the childhood, from the adolescence, go to the throughout the adulthood. So not saying, oh, she or he is still a child, so the mental health is not important yet. No, when we said about the mental health, it is same as our physical health, our body health. Okay, so no matter which stage are you, how old are you, or what stage are you right now, the mental health is matter. All right. Okay, so like I said before, which is the mental health is help us to define, or to make the choices. All right. So the person who have the stable mental health, the tendency to them to make the choice are higher, which is the best decision for them to make is higher, because they can think rationally. All right, they can compare which one is the best for them, which one is better. Okay, so over the course of the life, if you experience the mental health problems, or you have the unstable mental health, your thinking, your mood, and your behavior could be affected. Like I said before, the mental health refers to cognitive, the behavior, and the emotional well-being. So if one of the component affected, the 2 other component will be affected as well. So we have to look 3 component. Okay, we cannot simply like seeing them differently. Okay, so the most obviously can we see from the person is the changes of their behavior, because we can observe them. So for example, okay, your friend is a happy-go-lucky, as known as a happy-go-lucky person, but suddenly she or he become more reserved. She or he start to withdraw from the social or from the group. They avoid to make the communication. That is, we can detect, or that is the sign or the symptoms that something happened on them. So we better to check on them, so they can get the better treatment. So that's roughly about the mental health, right?
Yeah, I do agree with you that changes in behavior is one of the most important, I think, symptom that we can observe into people around us. Regarding the pandemic COVID-19 that you mentioned just now, I do agree to that point as well, because it's really undeniable that COVID pandemic has caused a really serious mental health issue to a lot of people. So basically, what are those? Is there any vulnerable group that are particularly will be exposed to the mental health issue more easily?
Alright, so I'm not saying this in pandemic during this pandemic. So I'm just saying mental health, which group is the most vulnerable in mental health as a general. Okay, so the first group is the childhood. Alright, so childhood years are a vital for developing the life skills. So when they go through the negative experiences in the home or even at the school, even at the playground, they can happen to bully in the playground, right? So they will, for instance, they can develop the unstable cognitive and emotional skills. So because they suffered the bully mentally, right? So the first group is the childhood. Like I said, the every stage of the life is important, right? So the second group is the adolescence. Why? Because the adolescent is a critical formative stage in life. So moving from the childhood, go to the adolescence. If the stress or the problem while we are in the childhood are not settled, are not handled or properly treated properly, they will bring the problem to the adolescence, right? So the stress will be stacked up or will be become more stressed at the adolescence. Okay, so while of that, in adolescence, they're exposed to the high peer pressure. Okay, they're influenced by their friends, the media social, and they also start to protest, right? So this kind of situation actually will affect their mental health. All right, so that's the second group. There's two more. First, the third is the adulthood group. Okay, the adulthood group. So when you are in adulthood, the concern is different from you are a child and when you are adolescents. All right, your concern is more to the work-life balance. All right, so you are thinking, you are getting a job or not? How many salary will you get? All right, they start to worry about their finances, their expenses, and the quality time for divide with their family and their friends. Okay, that are the adulthood concerns when they are grow up, and when they are working, they will feel the stress and the anxiety when they are working. So the relationship in the workplace with their boss, with their colleague, and the insecure about the work environment. While when they are in adult, the making decision day by day is a very worrisome. They make worry. If I choose this, it will be okay or not? It will affect me or not? Like that. Okay. So besides, they also deal with the family problems. I believe everyone have their own family issue, so we can't deny it also. And so, if they don't have a good coping skills, they will face the unstable mental health. So that is very important to have the good coping skills to ensure our mental health is a good in a good point lah. Alright. Okay. So the last one, people said, the older people will not get any mental health. No. Alright. Like I said before, every stage is method. Okay. So when we become older, we start to feel the loneliness. All the child go to work and you alone at the house because feeling the isolation due to the loss of the partner. Their friends also passed away, and they also have the uncaring family members, so they will feel the isolate, right? They will feel lonely, right? So this negative situation will also contributed to the mental health problems and elevated to the rates of depression also, right? So here I want to emphasize that all groups are risk and vulnerable, right? So when it comes to mental health problems, there is no specific like depression, which group is the most vulnerable. No, there is no specific group which is the most vulnerable. All stage and all groups are method when we mention about mental health. Okay.
Yeah. Really, there's no differentiation between those from adulthood or even from childhood or adolescence. So basically, everyone will have what you call a mental health issue, a possibility to get a mental health issue. So back to this COVID-19 pandemic. So actually, we see that we see that a lot of people starting having a mental health issue that ultimately they go for those what you call a really wrong choice for them, which is a suicide.
Or maybe we call it a shortcut.
Yeah, a shortcut. But I don't think that is a shortcut because it solves your own problem, but it doesn't solve the family's problem or even others' problem as well. So, particularly, I want to know about how does people's mental health problem is affected during this COVID-19 pandemic.
Okay, so there's a few stressor with the few points. Okay, the first point is the perception of safety, threat, and the risk of contagion. Okay, so during the pandemic, fear and the panic is in one set. Right, it come a set for you, right? So in fact, the individual's anxiety may cause to the increase when he or she hears about the first death of COVID-19 patient. So they will become more anxious, the anxiety higher, and because for example, I gave the example for easy understanding. So there's a people around my neighborhood got infected, right? So I will think, maybe after this I will get infected too. Okay, the anxiety is what we call it affects how we think and affects how we behave also, right? So the individuals will be more anxious about their own health, and about their family members' health also, right? Because the contagion. All right. So during this pandemic, the false information is always come out, right? Every day in the news, the false information about the COVID-19. So when they have the misinformation, will also lead to the anxiety and the perception that they are in danger, because the misinformation. My neighborhood have people got infected, but there's no people got infected in their neighborhood, but they feel like they are in danger. So there is the first issue, or the first what we call
fake news. The fake news that affect those people.
Yes. Yeah. Okay. And the second is the stress and the pressure of education. So this is experienced by the young adults who experience the pandemic consequences. Okay, such as the closure of universities, the schools, and the college, that they have go through the ODL, which is the open and distant learning. Okay, that every student have the different growing experience and the surroundings. Alright, so like we can read on the news, like a family that can't afford the devices for each children. Like you can imagine, like a family have 4 children. They have to have the 4 devices for each children to get the PDPR, or what we call the ODL. Alright. So but on the news, they stated like 36.9% of students doesn't have the proper devices, and even at the Sabah, okay, 52% of students doesn't have the connection of Wi-Fi, or they can't have access to the internet. So how they can access to the ODL if they don't have the connection of internet? All right. So while of that, we can hear about the college student or university student. They rant at the media social about how many and how big amount of tasks given by the lecturers. So it gives them a stress, pressure, because they keep thinking about the due date, about their quizzes, and about the program. Like me, I am a final year student. Before this, I doing the program like 2 or 3 program in one sem. So it quite pressure me, because we have to run it, online. We can do the discussion face to face and become hard to get the all members commitment, because when we are at home, we have a different roles. You are children, you are students, you are friends. So this is quite stress for a student, okay, while in this pandemic. Alright. So the third one is the financially lost and job insecurity. This for the workers. Okay, so because of this pandemic, our economy also affected and lead to the business disruption. So actually, the news said that increase of the mental health, like depression, the mood distress, and the low self-esteem. So during this pandemic, almost 53% of the workers who lost their job are reported have the mental illness symptoms. Right? So because they get anxiety, the insecurity, because they keep thinking, how will I feed my children? How will I feed my family? How can I pay my bills? So this kind of stress makes someone mental health affected. So as we can see, as you said before, James, like you read about the suicide case, right? Yeah. So this due to the people who lost their job and their business go down, so they decided to end their life. So this is the consequences of the pandemic to the people, right? Okay, so the last one is I just want to mention about the work overload. Even though we are working from home, but I make an example and I give an example for the frontliner. All right, they are still working when we are still at home. So even before the COVID-19 happened, the worker in the healthcare is stressful enough. But when the coronavirus outbreak, they become more stressed because the healthcare workers are facing to the unexpected stressor, right? So they have to take the longer shift. They have to work more working hours. The risk of infection, because they deal with the big amount of COVID-19 patient. Like today, the cases are rising, right? Like 6,000 something. 6, so yes. So and because of this, they have to keep the social distancing with their family also. So the isolation from their family and friends. And I must say, being a part of family or being a part away from the family is not easy. And it makes them lack of motivation, and this causes them stress because when they go home, they don't have their children with them. So it may cause a stress for them, right? So besides, they have to see the death every day, right? So this makes them mentally exhausted because they sadly can see the patient died in front of them, right? So it may cause them sad and like I said before, this mentally exhausted, right? Okay, so that if we can see from the frontliner, but if we see from the worker who work at home, right? So the worker who start the new norm to work at home, he also has experienced this kind of stress because they have the uncomfy spaces for work, because they have the an ergonomic chair, so the back pain and the amount of tasks given is also a big amount. So the boss doesn't care if you doesn't care even you are working at home. The task given is a must. Okay, so the stress are higher, right? So they can keep stay focused and productive when they are working hours. So because of that, the workers keep anxiety, keep anxious about their tasks and their job. So I think that's all for the how does people mental health is affected during this mental health. Affected during this pandemic.
During the pandemic, yes. I do agree that you just mentioned that there's a lot of fake news that's going around. Recently, yes. I saw that there's one fake news saying that one people that get vaccinated, and then after vaccinated, he eat durians, and after that he got having a health issue, and then suddenly death. This kind of fake news that will create anxiety in a lot of people's mind that is unnecessary at all. Yeah, so that's why I think that even government is going. I think it's the first time government giving any financial what you call financial assistance towards those NGO and association. Just like a few days ago, there's announced that a 15 million ringgit is being distributed to those NGO and association who is going on what you call mental health issues, assistance to the public. So that is why we can't ignore this issue anymore. And basically, it does happen in our everyday life, but it's get worsened during this COVID-19 pandemic.
Yes,
that's the thing that we need to take care about. Yeah. So regarding the what I call the statement that you just mentioned, is there any statistic that can support your statement?
Like I said before, like about the student, the stress. Okay, so like I said, the among the adult, the young adult from the 18 to 24, they reported they have the symptoms of anxiety and stress, which is the 56% of them having this kind of symptoms.
Wow.
Okay.
High amount.
Yes, because we can see as me as a student right now, I can feel the stress because right now I'm doing my internship also, so we can't go to the work, we can go doing our internship face to face, so it kind of stress for us. Maybe I am the one of the percentage of them. So I just want to say the student they feel stressed about their and they become more anxious about their results of this of study. And I said before about the worker who have the lost job, 53% of them are reported have the symptoms of mental illness. And the worker who have to sacrifice their salary, the company have to cut their salary because the company can give them more. So there is 32% of the person who lost their income are reported having the what you call the symptom of mental illness.
So going to the next question. So basically, what will happen if mentally is not healthy during this COVID-19 pandemic, or what you call it generally? What will happen if people are not having a good mental health?
Okay, someone will experience or they will be risk to the mental illness. All right, so because they have the unstable mental health, so such as the illness is the anxiety, the mood disorder, the depression, and this can cause to and lead to the suicide thought or maybe the suicide attempt, right? That the suicide attempt. So because they feel lonely during this pandemic, during the quarantine, and they feel the unworthy. All right. So the other consequences is for the students and the workers, they will feel unmotivated to done their job, to done their assignments, and to done their tasks, right? So the people will also get easily to get mad, to get upset to anything, and because something that will affect the relationship with the maybe they are in the same house with their family. If they get upset to anything, the relationship with the family will get worse. All right. So as well as if they are in a same house with the housemate, this will affect their relationship with their housemate as well. Right. So after that, they also start to think irrational and overthinking over something. And like I said, when they start to think when the thinking which is cognitive are affected, the way they behave, the way they act will be affected as well. So it is important to take care of your mental health So these kind of consequences not happen on you. Right? I think that's all.
Yeah.
Is it clear?
Yeah, it's very clear because that I think the ultimate wrong choice that people will make when they are having a mental health will be suicide. Is it correct? Yeah.
Yes.
There's the really sad thing that happened in their life. So we're talking about a lot of negative things just now. So let's talk something that's quite positive. Is there anything that we can do to maintain our mental health, a good mental health?
Okay, of course we have. All right, so first thing is you have to recognize that your anxiety is completely normal. All right, so because everyone is going through the anxiety, especially this outbreak of COVID-19, but the differences between the others is the level and how they cope with it. All right, so if the news of the newspaper about the you read on the social media worrying headline, because they have the headline, right? So such as the amount of the new cases making you anxious, making you keep thinking about it. So you have to know that you are not the only one who feel that way. Okay, so and actually that is how you should be feeling, and it proves you are normal. So don't saying that, oh, I'm anxious or I am anxiety right now. No, that is everyone feels that way, right? So there's a saying that your anxiety is going to help you make the decisions that you need to be making right now. So if you have the anxious, all right, is the good thing you have the anxious is you will be worried if you are spending the time with a group of people, because if I are in a group of people, I will get infected, so I will not go to that group. Okay, that's the good thing of anxious. Or the other hand of the, you will washing your hands, you not touching your face. There's a SOP, the what we call given by the authorities, right? Is it? Yeah. Alright, so that is very important to recognize the anxiety so that you can help yourself calm. So when you're anxious, you know, everyone feels this way, so I'm okay with this, right? So first you have to recognize that your anxiety is completely normal, right? The second thing is find the distraction. Okay, so there is one saying that it's helpful to divide the problem into two things. The first thing is they can do something about, and the second thing is they can do nothing about. So you know the problems, or this one I can do something, but this one I can do nothing. So I focus on what I can do. Right, so the other problems you have to leave and you have to let it go, because you can do nothing about it, right? So you can distract yourself with your hobby. If your hobby is going to outside, you have to find a new hobby to suitable for the new situation or new norm. Right, so like cleaning, decorate, the popular hobby right now, and you can watch your favorite movies, cooking, or maybe something else that way to make it easier for yourself and to find a balance in the everyday life. It is important to distract yourself because it helps you to forget what you anxious about and what you are worried about. Right, so the other thing is you have to stay connecting with people, with the others. Not saying you have to meet them face to face. You can do a Zoom, you can do a FaceTime also. So in a while of that, like when we are quarantined, like now MCO, you know how to developing the new coping skills, and always get enough sleep. Right, so even you say why you have to get enough sleep, it is important so you can get your body rest. Right, so and the last one is focus on yourself. Right, so you are the one who can change how you think, how to feel, and how to behave. You can ask someone, Siti, can you help me to change what I'm thinking right now? You can't. You have to focus on yourself, and you have to talk to yourself. I can change what I'm thinking right now. So you have to positive talk to yourself, so you can adapt with this new norm, right? So over 1 year plus, we living in this new norm, right? So it is a very important to you for remind yourself about this. So and you can depend to the others to make you feel better, but you have to find your own initiative to change, right? To growing or to make yourself more better. Okay? More better, to become better. All right. So while of this pandemic and quarantine, you can learn new thing. You can do something new. So before this, you are busy with commitment with your work. Maybe you don't have any time with yourself. So try to find a pastime to create a new activity for yourself, right? So the keyword is for yourself, not for the others, for yourself, because we want to focus on yourself, all right? So focusing on yourself and finding ways to use the time that is now available and a great way how to take care of your mental health, right? So, and we can learn nowadays. You can just Googling and you can search on YouTube how to do some relaxation. All right, so to help you to become calmer. And lastly, very, very important is get the professional help so they can help you holistically. So don't keep it by yourself. And remember that you are not alone. Even though you are in the house alone, but you are not lonely. All right. So there's, I think, some of ways how to maintain good mental health.
Yeah, I do agree with you that when you're having any problems, that just don't feel shy to talk to other people. Let other people to take care of you, to concern about you, especially when it comes to mental health issues. Miss Nurizzaty, there are a lot of people saying that mental health is not curable. So how do you think about that?
Okay, this thing is come up with from our surrounding, our friends. Like people said, I can do anything for a people or for a person who have the mental health problems. And the person who having the mental health problems, they can say, I can't be cured, right? So, but the fact is, friends and loved one can make a big differences. So friends and family, if you support the people who have the mental health, your closer, is it what do you call your friends? Yes, relative. Okay, they can be important influences to help someone to get the treatment, and you can support them to go the service and seek help from the professional. All right. So if you give the support, they will realize, I'm not alone. I have my friends, I have my family around me. They support me. Even I'm in this condition, I am good to go for seek the help from the professional. So and the other thing is help the person to reaching out to the mental health services, and make sure to letting them know that you are available to help them, right? So and you also have to know about the learning. You have to learn, you have to share about the facts about the mental health. And if you hear about the false statement or the fake news about the mental health, you can quickly object the statement saying that isn't true. The mental health can be cured, like that. If the fake news saying that the mental health can be cured, you can object that statement. And you have treating them respect. And the first and not the first, but the important thing is refuse to define them as by their diagnosis. Like the example, the person is diagnosed as depression. So you call her or him, depression. You call him like that. No, you can just publicly saying that word to the person who having the depression, and don't easily labels for those who have the mentally problems as crazy. Saying, you are crazy because you go to the counselor, right? You have the mental problems, you're crazy, right? Because you go to the psychiatrist. No, you have to give them the support so they can confident and they can do the treatment better, and they can go to the session consistently and do the the test, and they can go through that mental health problems, right? So I think that's the answer for your question.
Yeah, thank you for your answer. I think it's not only solving my question, it's also solving the what I call a problem inside everyone's mind, that saying that a mental health issue is not curable. So this can clarify to everyone else that think that mental health is not curable. That's really good. That to tell the public, fake news sometimes is really disastrous to the one who heard about it. But
Yes.
I think that depends on the people who heard about it. So hopefully the fake news won't give much impact to those person who are having this mental health issue, because I think that would bring even more what I call more serious consequences to them.
So I think that is important for each person of us to have the knowledge of the mental health, so we can recognize, or we can know the statement is true or not, and also we can have the knowledge about the symptoms, the signs. So if the person around us have that symptoms, we can ask them to go ask for the help from the professional, and so they can free from the mental illness and live their daily life positively. I think that's the main thing, is you have to have the knowledge of what is mental health.
I think that's all for today's online videos. It's a pre-recorded one because we are having a pandemic right now, so we cannot have a face-to-face what I call interview with Miss Nurizzaty. And we are really thank you, Miss Nurizzaty, for willing to come up and to talk about the mental health issue to the public and to create awareness about the importance of mental health issues. Really thank you, Miss Nurizzaty. See you guys next time. And don't forget to subscribe, to like and share on Facebook, YouTube and Instagram for Next Gen Link. Till next time. Thank you. Bye.